Thank you very much, Mr. Schwanar. And I have more to add. I don't have a PowerPoint, but I will begin with my words. We still stand behind many of those comments and much more confident behind them. My name is Maria Papaioannoy-Duic. I'm the spokesperson for Rights for Vapers. First, thank you for including us, our movement, in this process. I would like for it to be noted that this is not a fully inclusive process, as over 20,000 individual submissions were made opposing flavor bans in 2021, and not a single private person who vapes or an allied individual who supports access to vaping products, flavors for vaping products, has been asked or invited to give their updated feedback. These are the most important voices for this discussion, not anti-tobacco and anti-vaping lobbyists who have no experience with smoking, vaping, or our cessation. I feel the tremendous pressure to speak on behalf of all Canadians who currently vape and who are concerned about continued access to the product that has saved their lives, and for the 5 million Canadians who still smoke. Rights for Vapers is a movement. Our goal is to educate and empower Canadians who smoke and vape, to help them engage confidently with government and officials, to share their stories and speak up and out about how vaping has helped them stop smoking, to help shape fair and equitable regulations. Today is the Ides of March. When I first got the invitation, it did not go unnoticed. And a bit of me couldn't help but draw a parallel between what is happening today and that classic Shakespearean play we all read in high school, Julius Caesar. From the crowds, the soothsayer bellowed out a warning to Caesar: beware of the Ides of March. How can we not think Canadians, all of us who vape and smoke, are collectively walking onto the Senate floor to have our fate sealed? Will Health Canada, through the Minister of Addictions and Mental Health, kill safer nicotine options while still allowing for the deadly cigarette to be available? I'm not going to believe that. I am a cup half full kind of person, and especially on today, because the Ides of March holds a completely different meaning for me. It is a special day because this is the day I left my final treatment program. I have loved this day because I think of it as a second chance, an opportunity for change, to pause, to learn, and use knowledge to move forward, to make informed and compassionate decisions. So today, instead of thinking about it as a day to beware, let's look at it as an opportunity for all of us to learn about the ever-growing body of evidence that flavors are critical to the success of vapor products as a tobacco harm reduction tool, and to understand that banning them will cause more harm and the intended goals will not be reached. Our actions, our initiatives, every presentation that we have given since making our submission in 2021 has been consistent. Unfettered access to flavors matter. A flavor ban is not a magic bullet that will solve the problems that are viciously blasted through misleading headlines by what I call the classic 5 tobacco control organizations in Canada: Heart and Stroke, Cancer Society, ASH, Coalition de Tabac, and Physicians for a Smoke-Free Canada. Youth vaping rates will not go down. More adults will return to smoking, and we will have a less safe product on the market. We also remain profoundly confused by the endless focus on youth vaping and flavors, despite youth vaping rates being lower than those for cannabis and alcohol products, which coincidentally come also in a wide variety of flavors, including candy. There has been a great deal of confusion surrounding this consultation. We were shocked to receive the invitation to appear today. I've spoken to Canadians who vape from across the country over the last week, and they are worried. They thought that the file was closed. We thought that this file was closed. Actually, everyone thought this file was closed. Some of the messages that we received is, I see a lot of people talk about how flavors got them off cigarettes, trying to sway officials. I don't think the government really cares about those personal stories. What is the point, said someone else. It doesn't matter if we sign petitions or register online for whatever. No one seems to care. I continue to have faith because Health Canada has come a long way in accepting vaping as a tool for tobacco harm reduction. It has changed wording on its website. It categorically states that vaping is less harmful than smoking. It connects with people with lived experience, and it has shown restraint in implementing new regulations. But what has changed now? Jay from Vancouver said, Health Canada, the Minister of Health, and Minister of Mental Health and Addiction are sending mixed messages. We care about the mental health and well-being of Canadians. We've set a goal for 5% smoking rates by 2035, but we're going to render useless the very product which helps Canadians remain smoke-free or transition from smoking to vaping. What has changed? Since the cabinet shuffle back in the summer, the Classic Five have been signaling out the new Minister of Health himself in every press release and statement they make. At first, I thought it was a bit sexist to ignore the female minister who is actually in the leadership role of this file. So it didn't make sense to me. And the only way to understand is to put ourselves in their shoes. And if I'm going to ask others to do that, I must do it myself. So I took a look at this from a compassionate lens. I committed to learning about Minister Holland. He seems like a great guy. He has consistently shared about his own struggles publicly. After taking on this role, he went as far to share and show his vulnerability to all Canadians about his own mental health crisis. I get that. I connected in that moment with his story and his desire to be public. I may not have an audience as large as his, but I too am open and share about my addiction and my road to recovery, because sharing stories and lived experience helps people. As I learned more about the minister, I found out that it was the Heart and Stroke Foundation, a member of the Classic Five, that gave him an opportunity when no one else would. In his words, I found a real purpose in health promotion, and in prevention. I can see a scenario where his former colleagues continue to call on him with the messaging that he has to follow the course, as if their past relationship entitles them to make the rules and trump science and process. I understand he is in an awkward position between Canadians who want to use vaping products and those who want to stifle them and force Canadians back to smoking. But I'm sure he'll do the right thing. In 2022, since our submission, the Cochrane Review released its latest findings on vaping, and they said there is a high certainty evidence that electronic cigarettes with nicotine increase quit rates compared to nicotine replacement therapies. The science is there that vaping works. Our position on vaping hasn't changed over the years. Vaping is less harmful than smoking. Vaping has extended and improved the quality of life for countless Canadians. And flavors are a critical part of keeping people smoke-free. Canadians who vape have accepted a lot of regulations that have been designed to make vaping less effective, less available, and less affordable. The fear of losing flavors has been the one element of vaping that not a single person who uses vaping products is willing to give up. And that should scare all of us. Canadians who vape have made it clear many times. Let's look at the Health Canada report from 2019. Almost 23,000 postcards were sent from people across Canada who use vaping products. None of the postcard submissions were supportive of further flavor restrictions. It proceeded to say that flavors were by far the topic that garnered the most input, even when the postcards were excluded from analysis. Then in 2021, when Health Canada first proposed this ban, over 20,000 Canadians submitted their feedback. Their message boiled down to 3 words: flavors are important. This is still the case in 2024. I'm sure that many of you have never smoked or vaped, and that's okay. But for a moment, I want you to put yourselves in our shoes. Imagine you smoked and wanted to quit. Would you opt for a tobacco-flavored vape reminiscent of smoking? Or would you prefer something more enticing that doesn't evoke the familiarity of burnt tobacco? The vast majority of people who smoke choose a flavor. Flavors are key for adults starting vaping as an alternative, linked to more attempts to quit and better success rates, again, as shown in the Cochrane report. Banning flavors makes vaping less appealing for quitting, It also boosts illegal supply and risky home mixing. Plus, studies reveal flavor bans don't cut down youth vaping rates. Associate Professor Abigail Freeman's research on the impact of e-cigarette tax on youth tobacco use sheds light on the unintended consequences of flavor bans. The study from 2022 found that San Francisco's flavor ban led to more than double the likelihood of recent smoking among underage high school students compared to other areas. Additionally, adults who vape non-tobacco flavors are more than twice as likely to quit smoking compared to those who vape tobacco flavors. However, we don't have to fly out to San Francisco to see what's going on with a flavor ban. We simply need to look to Quebec. After countless months, perhaps years, from the Classic Five advocating, on October 31st, 2023, Quebec banned all flavors of vapes, including mint and menthol. The government caved to the demands of the same group that just last month demanded their former peer, Minister Holland, to do the same. Quebec did not regulate based on science. Quebec did not give adults a choice. Quebec caved to the demands of the Classic Five and their anti-vaping sloganeering. Quebec did not look at the lived experience. This draconian regulation was built as a way to stop kids from vaping. We believe that kids should not vape. Full stop. We also want to ensure that adults have access to a wide range of vapor products that help them quit smoking. Why must it always be a choice? Choices have consequences, and the consequences playing out in Quebec. The banning of flavors absolved the government of any responsibility when it came to enforcement. What is forgotten is this industry was created by people who smoke for people who smoke, not big tobacco. And when it comes to access, the ingenuity of the vaping community exploded. As Kay shared with us via email, we just have to stop listening to the government. I still produce salt nicks e-liquids for all my friends. I would love to see the government try to stop me. Today in Quebec, you can purchase flavor enhancers pretty much anywhere. In a recent article in Le Soleil, the regulations are referred to as a fiasco. The reporter found that there is a major discrepancy in how the regulations are being enforced. The investigation found that 90% of vape shops sold flavor products. Only one vape shop was charged with noncompliance. Anyone can buy vapor products online and through any social media tool and have them delivered straight to their home. And to this day, if you walk down the streets of Montreal, you can still smell the strawberry, vanilla, and cherry in the air. The government of Quebec handed the vaping industry over to the black market, effectively giving the role of public health to a criminal entity. Along with this inventiveness comes risk. Do we want everyone making their own e-liquid? If you don't know what you're doing, it can lead to a dangerous mix. This is exactly what happened in 2019 with the Valley crisis, which to be clear was the result of hobbyists mixing THC with vitamin E acetate in illegal products, not vaping. However, the risk can be transferred to vaping products because people resorting to unregulated practices without understanding the consequences can cause harm. Currently, there are thousands upon thousands of flavors available on the market, some water-based, others oil-based. However, do you believe the average Canadian knows the difference? Vapor products should be regulated to protect not only youth from accessing them, but to protect people who want to use them and having them safe. And keeping flavors is part of that. The Classic Five were created to stop big evil tobacco companies from lying. It was to stop Canadians from smoking, not stop people from quitting. For example, it was deeply disturbing to see one of the members of the group with a recent post suggesting there is no health benefit to switching from smoking to vaping. These organizations are demanding that vapor products be regulated in the same way as cigarettes, although they couldn't be more different. This fundamental misinformation stops people from trying vapor products as a way to quit. In Health Canada's own discussion paper on the second legislative review of TVPA, it stated, while cigarettes continue to make up most of the market, the number of industry-reported cigarettes sold in Canada declined by almost 42% from 2013 to 2022. Two-thirds of that decline occurred since 2018, the year the TVPA was implemented and vaping products with nicotine were legalized in Canada. I don't think that's a coincidence. Moreover, the 2021 and 2022 declines were the largest year-over-year declines observed in Canada in more than 20 years. Your own review tells us that vaping is working. During the Senate hearings for Bill S5, which is now TVPA, the former Minister of Health, Jane Philpott, reassured Senator Eglinton that there would be no restrictions on flavoring that would make the products unpalatable for adults who wish to switch from smoking cigarettes to flavored nicotine or non-nicotine vaping products. Yet this proposed regulation that I fear is making a comeback will do the opposite. How many of those Canadians who switched to vaping will return to smoking because of a flavor ban? It wasn't until after the submissions were made we were able to fully understand the devastating impacts that the current proposed ingredients list would have. Limiting flavors to tobacco and mint is one thing, but to allow the use of only 82 pre-approved ingredients on the Health Canada list will be disastrous. One substance is suspected of causing genetic defects, 3 are suspected of harming fertility of the unborn child, 6 may cause cancer, and 2 are not safe for human consumption. How can any Canadian who wants to quit smoking or vapes trust that Health Canada, tasked with the safeguarding of public health, truly considers their well-being when they look simply at the provided ingredient list? There are over 400,000 flavor compounds that exist in the Canadian market, yet the vape industry, who are the subject matter experts, were not part of the consultation in crafting a list. Consequently, exclusion created a harmful product. Before I move on, I just want to get this off my chest. Can we just start over and not piece together a proposed regulation that will do more harm than good? And if you or anyone in government could grant me just one wish and be my genie, it would be to lock all of us in a room together, the classic 5: regulators, innovators, thought leaders, people who vape, people who smoke, and industry, and don't let us out of that room until we come to a set of regulations that are fair and equitable for all. Because what we have been doing is not working. We need to get back to working and doing it right. It seems that we're all trying to start a Tesla by filling its gas tank. People who smoke frequently face discrimination, even as efforts to tackle addiction persist. Despite the alarming portrayal of smoking as a lethal addiction, claiming over 100 Canadian lives daily, stigma persists. Language that shames those battling tobacco addiction is not only accepted, but also regulated. It's astonishing to witness stigmatizing messages on cigarettes. Equally surprising is seeing the same stigma being transferred to safer alternatives like vaping. Ironically, it was the passage of TVPA in 2018 that increased the stigma surrounding vaping. With clear regulations, suddenly big tobacco was in the mix. The small businesses that were the core of the vaping were tainted by the association of big tobacco. The best evidence for combating stigma and addiction can be found on Health Canada's website. Stigma makes it harder to reach out for help. We can make it easier for people to get support by letting them know they are not alone and that substance use does not define who they are. Addiction is a treatable medical condition, not a choice. Why are people who smoke and vape not given that same kindness and compassion? When safer nicotine delivery methods arrived on the market in 2010, I and many other Canadians started vaping 14 years ago, 8 years before regulations. And instead of embracing the reduced risk, for the most part, we've been subjected to more shame than before. The recent events, particularly our observations during FCT's COP10 meeting and through social media revealed the pervasive nature of this shame. We witnessed leaders from the Classic Five at COP use stigmatizing and shaming language against anyone that spoke up about tobacco harm reduction. I too was in Panama with advocates from around the world who were looking forward to Health Canada standing up and sharing their approach to tobacco harm reduction. And we eagerly anticipated what the Canadian delegation would say. When THR was brought to the floor, we were hopeful for someone to speak up for its inclusion. However, Canada remained silent alongside other harm reduction nations. It was a crushing blow, as it signaled for me a shift in momentum towards those opposing vaping. And then we saw something worse. The cancer-flavored vapes that were touted on social media by the observers at COP, passing them around with giggles and laughter. Not a single person at that event stood up against the weaponization of the most deadliest disease in the world. That is how much people who vape are hated. We must challenge the prevailing attitudes that perpetuate stigma and shame. Every individual struggling with addiction deserves empathy, support, and access to resources for a healthier future. Finding a balance is going to be hard, but we can do hard things. Today, I'm ending with 3 requests. They are simple, and I hope they will save lives. 1, work to stop the stigmatization of people who vape. Rights for Vapers speaks for the Canadians who have chosen a less harmful alternative to smoking. They have taken their health into their own hands, yet they continue to be stigmatized by the Classic Five. Why do they want to discourage people who smoke from vaping? We should all be on the same team. Number 2, show leadership in the provinces. Today, there is a patchwork of regulations that makes no sense. One way you could do this is by moving forward with relative risk statements on vapor products. Make them legal, especially in places where people go to get the most advice for their vaping products. Canadians need to know that vaping is less harmful than smoking, and no one should be subjected to debilitating fines and fear of jail for simply telling a consumer facts and truths about vaping, especially when people who lie have no consequences. Number 3, keep flavors available to adults who smoke. Stopping kids from vaping is going to be hard work. Let's just start by enforcing the current regulation at the federal level. Anyone who sells a minor a vaping product is breaking the law. They should be fined, and $3,000 is not enough. As well as using any non-compliant ingredient, these are where we need to start. If you ban flavors, you will turn the vaping industry over to the black market. No regulations, no safety, no precautions, no taxes. Literally, biker gangs will be our public health. In conclusion, I truly am thankful and grateful for including Rights for Vapers and me in today's consultation. It demonstrates that you have an interest in the lived experience of the people who actually use this product. I just think that it could have been more inclusive. No individual who submitted their position in 2021 was invited. Since 2021, when Health Canada closed consultations on this amendment, over 150,000 Canadians have died from smoking-related diseases. None have died from vaping. Thank you.
Thank you very much. Sonia, I don't know if you wanted to make closing remarks.
Yeah.
We've done the presentation of the comments, and thank you for sharing those additional views with us. Over to you, Sonia.
Perfect. Thanks, Denis. And I'd like to also thank you, Maria, for providing such heartfelt remarks. I know it's a big job that we're asking you to sort of represent everyone who's vaping in Canada. And so your point about, that we weren't including others who had provided the submission. But I'm glad that there are a number of people in attendance observing today to be able to hear the discussion. Your points have been well noted, and there are others on the line who are taking note as well. And I do want to acknowledge as well, you know, when you made the comment about this coming as a surprise to a lot of people, and I can understand, you know, where that's coming from, because, you know, as we noted in our presentation, we did go out in 2021, and so it could be for, you know, for Canadians not aware of how that these processes work, and coming to an assumption that maybe this wasn't continuing to be looked at. So appreciate those comments there as well. I think those are good for us to hear. And again, just to reiterate sort of what we said at the beginning as well, this is something that Minister of Mental Health and Addictions has asked us to look at in terms of preparing a regulatory package for her consideration this spring. And so I think having the meetings that we've had with various groups and ending with your group today, I think is very informative to be able to confirm sort of the pieces that were raised during that consultation, but also since then, given the time that's passed, and new experiences, new evidence, et cetera. Those additional points that you raised as well, which again, we've taken note of. So we do want to thank you for, you know, engaging in this very respectful and civil conversation, knowing that there's a lot of emotion behind it as well. So do appreciate that as well from you. And I wanted to thank those who took the time out of their day today to join us and to listen in on the conversation, and to have a better sort of sense of, you know, the email invite that went out to you the last week or so for today's meeting. So with that, I don't know, Marie, if there's anything else you wanted to add before we close for today.
Just very thank you. And Mr. Chenoir, I heard through the grapevine you're retiring, so good luck on your next chapter in your life. I hope you follow all the dreams you couldn't while taking on Health Canada. I wish you all the best.
Thank you.
Thank you very much. So that will conclude our meeting, just a few minutes ahead of schedule. So thanks again, everyone, for your participation today. Much appreciated.